I met Brittany through Wood County Schools when Brittany was doing therapy for our students, and I have taken therapy from Brittany several times with leg problems. Then more recently, I had both hips replaced. My surgeon did not require me to have physical therapy on the first hip replacement, and it went very smoothly. I didn't have a lot of trouble. I spent most of my time just walking, and that went really well. And the second hip was not the same. I'm told there was nothing wrong with that hip other than what he was expecting, but for some reason it was harder to heal, it was harder to recover from, and he insisted that I take physical therapy for it. Prior to my surgery and physical therapy, I could barely walk. I could not do anything household related. I couldn't do dishes. I couldn't do any type of housework. Climbing the stairs was almost impossible. I hadn't seen the upstairs of my home for months because it was so difficult to get up the stairs. I couldn't roll over in bed without assistance. It was difficult doing most anything. My goals for physical therapy, other than to be able to do normal things, normal household things, normal routine things, is to play with the grandchildren. I kind of had a misconception about physical therapy in that it would be painful, that it would hurt, that it was gonna make me extremely uncomfortable, but that's not what physical therapy is. Physical therapy is getting you where you want to be without pain. That doesn't mean it's easy all the time, but Brittany and the folks at InMotion take you to the point where you're pushing yourself so that you can get better, but you are not in pain. It's not painful. And when you get to the painful point, they stop, and you get where you need to be through repetitive work. I like InMotion because it is a calm environment. Everyone is knowledgeable, everyone is friendly, even if they're not your therapist. They're good to me. It's a very nice facility. It's a good place to be. I feel comfortable here, and I don't feel like I'm expected to perform when I can't. I don't feel out of place. I feel like this is a place that I can belong to get my physical therapy, to get myself better. After surgery and physical therapy, I can do almost anything I want to right now. I'm still a work in progress. The leg is a little bit stiff, but I'm there. I can now do pretty much anything I want to. Distance is still a problem for me as far as walking goes, but I can now do everything I couldn't do before surgery.